I'm gonna demonstrate some dry needling on Kurt. I'm gonna do some dry needling for SI joint pain. So primarily the discomfort is on the right side in him. And what I'm gonna demonstrate is some needling in his lumbar PVMs, and we'll be right here around what's called the iliolumbar ligament. Then we're gonna do some needling in his glute around here, and then a little bit closer to his sacrum. Some of these are actually traditional acupuncture points, and I'm certified in acupuncture too. I do primarily do dry needling, so what we're looking for here are trigger points. So if we find his SI, and then come down here off L5 spinous, and then just come a little to the side. Do you get any tenderness in here, Kurt?
It is a little tender.
This isn't a strange place to just have tenderness. I mean, we're right here next to the spine, so it's pretty common. And there's also what's called the thoracodorsal fascia. So we got a little twitch there. Did you feel that, Kurt?
Yeah.
The thoracodorsal fascia is the kind of the tendinous portion of the lats that comes, there we go, all the way down here and attaches in this area. So underneath the epidermis, just the top layer of skin, we've got to go through that too, and then we can hit those lumbar extensor muscles, iliocostalis and multifidus, and all the other rotators and muscles that are in there. So I'll usually do a couple right here, just along the low back. This is really good for low back pain. If you have low back pain, dry needling can help release tension, pain, and trigger points down in the lumbar spine. So we're gonna go a little bit higher here. And sometimes you'll see these muscles twitch with dry needling. You don't necessarily, you can see that one there, need a muscle twitch to have a good outcome for treatment, but I would say that when we do get a twitch, it tells me that we're in the right area. Big one there. A muscle twitch reaction like that is a unique sign of a trigger point. So it tells you that there is a trigger point in that area, and trigger points are just little units of muscle that are kind of stuck in contraction that can cause pain. They don't have as much oxygen supply to those muscle fibers, and so if we can release those, we can increase microcirculation to the area, we can decrease pain, we can get that muscle functioning how we want it to. Gluteus medius dry needling. And what we're doing is we're just working way here on the outside. You can see that muscle twitch reaction. That's a normal thing. That tells us we're working in the right spot. Get a big muscle twitch out of that. And typically what I'll do is I'll move that needle around until that muscle stops, and then we'll just come right out with it. Is it painful, Kurt?
That one was a pretty decent jump.
Yeah. So sometimes when we get the jump, it feels strange. That's what patients tell me.
Yeah.
The most of it is just surprising, right?
Yep.
It's not necessarily painful. Now, if you do have some discomfort down there, it can be a little bit more sensitive. But it's a really safe treatment. It's not a super painful treatment in general, especially compared to other things that you can try, like a steroid shot. They're also using a needle, but it's a different kind of needle. This really doesn't feel anything like that. What I'm going to demonstrate here is the deep gluteal trigger point. So this one's really like right here in the center of the buttocks. And what you can do is you can just find the SI joint, which is this tough spot, the outside of the hip, and just kind of go right into the middle. And this gives us some access to the glute max primarily. Deeper under there we'll get med. And you got to use a longer needle here because there's a lot of adipose in the butt to go through. We got a nice little twitch there. You feel that one, Kurt?
Oh yeah.
Typically what I'll do when I'm treating the hip is I'll work affected muscles, which are commonly glute max, like I just showed you. I'll work gluteus medius, gluteus minimus. I can get to piriformis deep underneath there, and then I'll also work lower back because there's some involvement there. And then we can also flip them over and work psoas as well, is another option. People talk about tight hip flexors, they're stretching their hip flexors and they just won't loosen up. And that can be really frustrating. A lot of times it's not just stretching, it's really getting to some strengthening exercises and getting there and releasing some of that tension in the muscle.